Hi everybody, welcome back to part 4. We'll pick up where we left off on part 3. This part is short because we're almost done. Okay, so we were talking about where we left off on Medicare fraud and abuse, and I talked or introduced you to RACs, which is Recovery Audit Contractors. Now in your textbook for this course, you may want to look up RACs and MACRA and MIPS to get more information because those are not included in the slide information, but it is in your textbook. Medicare, Medicaid fraud and abuse continued. Examples of fraud and abuse, the healthcare provider bills for services or equipment that the patient never received, and the patient may never even know it was billed to them under their Medicaid or under their account. Or someone uses another person's Medicare or Medicaid card to get medical care and equipment. That is theft, and if caught, that person can go to jail. Or a provider bills for home medical equipment after it's been returned. It's been returned, they give it credit, they don't process it, and they bill Medicare for that equipment anyway. It is not abuse to complain about the quality of care from a physician, hospital, or other care facility. Okay, so if you have an issue with your provider and you complain, that does not mean that is not Medicare fraud and abuse. That's just a quality of care issue, which is a whole nother ballgame. The Medicare website at medicare.gov offers options for Medicare recipients to inquire about services. They can file complaints, they can make a grievance, and they can appeal decisions, and it's all online. If you wanted to fight Medicare and Medicaid fraud, they have what are called SMP, which Senior Medicare Patrols. And that they educate older adults who get benefits to detect and report fraud. And you may have seen ads of this on television or may have heard on this. But basically what the ads do, it says when you get that EOB in the mail, your explanation of benefits, if you see a service in there that you never received, or if you see that you got a piece of equipment that you never received, or something looks funny, report it, because that's one way to help prevent healthcare fraud and save taxpayers dollars. There's also an online brochure that you can get. It's called stopmedicarefraud.gov, which is also great for reporting fraud. And then there's HEAT law enforcement activities. Now, I'll just give you an example. Many, many years ago when I worked in healthcare, I was doing Medicare billing. I made a stupid mistake. We were giving flu shots. We were billing flu shots at $10 a person. I hit one too many zeros, and they got billed out at, I think they got billed out at $1,000 a person, something like that. Anyway, we got this big Medicare check, and this was a long, long time ago. And we knew instantly as soon as it came that it was a mistake or shouldn't have happened. Well, you can fix that. You just do a process and you submit a correction bill and it's taken care of. But what's interesting about that, out of the 100 that we billed, only one person brought in their EOB and said, this looks really like a weird charge for a flu shot. And we said, yeah, it is. We're really sorry. We made a mistake and we're getting it fixed. Now, the people getting the EOB didn't care because they weren't paying anything for that, because Medicare paid at that time $10 for the flu shot, so the patient didn't have to pay anything. But out of all those people, only one person noticed that on their EOB. Workers' compensation. That's another form of insurance that provides fixed monetary awards to employees who are injured or become sick during the course of their employment. It's workers' comp. It doesn't matter who is at fault, even if it was the employee's fault, they got hurt at work, workers' compensation is still picking it up. Okay? In exchange for a monetary award, an employee gives up the right then to sue his or her employer for negligence. So if you get workers' comp, and let's say you sit down on a chair funny and you fall off it and the workman's comp claim is filed, that employer is responsible for that care, even though you were at fault. But in exchange for that, you give up the right to sue that employer for negligence. Now, there may not have been any negligence in that case, but it's important to know that. You also need to know if it's a workers' comp claim, that employer has a right to any health information on you related to that claim. Nothing else, but just the claim. Workers' comp is not a disability insurance, and it's not an unemployment income. And the cost of workers' comp is paid by your employer. It is not paid from a payroll deduction. So the benefits, it's wage replacement in case you're unable to work temporarily. You can get compensation for economic loss, both in the past and the future. It's medical benefits and benefits to survivors of employees who are killed in work-related accidents. Workers' compensation from state to state. Federal government provides workers' comp for non-military federal employees, and that's administered by a federal office. And then state governments, all states have some kind of workers' compensation agency. So, financing healthcare summary, just a summary from 3 and 4. Government health insurance operate on federal, state, and local levels. All programs are subject to legislative change. So even though it's like this today, it may not be like that tomorrow. And you remember, any legislative changes are published in the Code of Federal Register. So just so you remember that. Fraud and abuse is a challenge for government programs. Medicare has gotten very, very good at detecting fraud and abuse, and they're very aggressive in going and finding people who commit fraud and punishing them through the court system. And then workers' compensation provides coverage to injured workers. Okay, so in week 12, we're continuing financing. There's still more to cover. I appreciate you sticking with me through 4 of these for this week, but this week is the exception rather than the norm. So we will visit with you next week. Thank you.